If you've been told that observation and surgery are the only options for scoliosis, I want to explain what sits between those two options and why most families never hear about it. The Clear Institute is a multimodal protocol. It's non-surgical, research-backed scoliosis treatment system. I'm Dr. Justin Dick with Clear Life Scoliosis here in Charlotte, and I'm going to walk you through exactly what this is. CLEAR stands for Chiropractic Leadership, Education, Advancement, and Research. It's an international nonprofit organization that's been developing and publishing evidence-based non-surgical scoliosis protocols since the early 2000s. I hold a Clear Institute Fellowship and Board of Directors seat, one of only 5 globally. And I'm on the only Clear certified clinician in the Carolinas that's published research on scoliosis outcomes in PubMed. Scoliosis is a 3-dimensional problem. It has a coronal curve that shows up on the standard side x-rays with a bend in it. But it also has a sagittal imbalance and an axial rotation component. The rib cage and vertebra are twisted. A treatment that only addresses one of these 3 dimensions is treating only a fraction of the condition. The CLEAR protocol was built specifically to address all 3 simultaneously. First, whole body vibration. The patient stands on vibration platforms at specific frequencies. This isn't exercise, it's neurological priming. It reduces asymmetric muscle tone and makes the nervous system more receptive to the corrective work that follows. We always start here. Second, mirror image traction. This isn't just structural correction component. We position the spine in the exact geometric opposite position of the curve. There's specific radiograph deviation, and it holds under a controlled load. This produces ligament remodeling. Spinal ligaments under sustained corrective force permanently adapt in the direction over time. This is what this produces: measurable Cobb angle reduction. Third, scoliosis-specific exercises, not just general core exercises. Targeted neuromuscular re-education that activates the inhibited muscles on the concave side of the curve and reduces the overactive muscles maintaining the rotation. These are done in corrective positions and also form what the patient's home care program is. Fourth, mirror image spinal adjustments, delivering in a corrective direction relative to the patient's radiographic findings, not just generic adjustments. The neurological response creates a mobility window that makes the traction work better. Fifth, cervical correction. Most scoliosis protocols ignore the neck entirely. My published research presented at the IRAP Symposium here in 2026 that what did win an award found that 100% of adolescent idiopathic scoliosis have instability in the neck and they lost their cervical curve. This is impacting the neurology that we know inside. We offer 2 program formats. The standard program runs 2 to 3 sessions per week over several months. This is generally for local scoliosis patients here in Charlotte. The intensive program compresses that treatment into consecutive daily sessions over 1 to 2 weeks. This is designed for families traveling from outside the area or patients who need more care for rapid progression. We see lots of patients, specifically from outside the Carolinas and outside the country, that travel here for 2 weeks to get maximum outcomes quickly. You can see this in my published journals in PubMed on our results that we can get quickly in 2 weeks. The CLEAR protocol is appropriate for children, adolescents, and adults with scoliosis. The goals differ by age: Cobb angle reduction in growing patients, stabilization and pain management in adults. The protocol is adapted for each patient's curve and characteristics and clinical picture. If you want to understand whether the CLEAR protocol is appropriate for your curve or your child's curve, the starting point is a proper evaluation. Weight-bearing radiographs, Cobb angle measurements, and an honest conversation about what the findings mean and what the options actually are. I'm Dr. Justin Dick here at Clear Life Scoliosis and Chiropractic Center here in Charlotte, North Carolina. The link to the full protocol page and our booking system are in the description. We see patients from across the Carolinas, nationally and internationally for intensive programs. We'd love to meet you soon.